his face, whenever he would talk, only his mouth would move. Nothing else on his face would move. Because he had Botox and everything, so that he could stay young. So the bold and the beautiful, what did you expect when you hear the bold, the beautiful? It's not a trick question. Mayas.
Yes.
When you see that title, The Bold and the Beautiful, what would you expect of the show?
Maybe nice faces.
Nice faces, yeah.
Doing what?
Well, if you see Emmanuel was being chased away. Yes. And then later on, we started getting soaps from Mexico. They were so good. When will you be mine? Now, I had a rule in my house that children should not watch soaps. Okay? I said, why are you so concerned about what is happening in fictitious lives? Why don't you live with people and interact with real people? And I had a very hard rule and I was very happy with myself. Let me sit down one day and I hear my daughter, she's 4, discussing seriously with the house help what happened at Kwanzaa Fair yesterday. I was thinking, what is going to happen to that person? Yeah, because they used to watch it. Then they'd switch off the TV when they knew I was about to come. And they would make sure they'd switch it off so that it could cool. Because I'd come and touch it. Parenting is not for the faint hearted. Yes. So Kwanzaa, when will you be mine? So clearly you can see somebody trying to find somebody to be maybe their partner, and it's not happening already. You can tell from this title. So we say that, I know we don't use this word in science, but you should have a sexy title. You should have a sexy title. A title that grabs people's attention, you know? Why not? Even if it's science, why not? Okay? So here are some examples of titles that we are going to go through now. We come back to science. Hiyo ni matende kucho. Au umecheka sana. Higher. Eli, please read this first one. It's got a lot of English. And where you were born, you started with English. So you read that first one.
Sure. A multi-level policy analysis of diet and healthy placemaking. Implications for low and middle-income countries in Africa and the Caribbean. A case study of Kisumu City and
Kenya. What do you think that study is about? I've given you a hack, purpose, population, procedure. What do you think the purpose of this study will be? Who do you think the population is? And what do you think the procedures will be? If you get the answer, you'll be the first ethics committee that has ever got the answer to this study, because this study was exceedingly obscure. The title was exceedingly obscure. The study was a good study, but the title, what do you think it could be? Anybody want to try?
Yes, they're looking at the policies in an area to see how they correspond to nutrition.
Mm-hmm. So they're looking at the policies and how they correspond to nutrition. Okay, so that could be the purpose. So who do you think the population could have been? Or the procedures? Yes?
The study was on
That's the study set.
Yeah.
Yes.
But what about the population? Who are they talking to?
low and middle-income countries.
Okay, but who are they talking to in those low and middle-income countries? What were they talking to them about?
We are checking the policies.
You're looking at the policies, so who do they talk to?
Maybe they would target the local governments.
Maybe they would target the local governments, yeah.
Like, how can you say it?
Pardon?
How can you say the local government, because there is nothing?
No, it's a policy.
Policy, yeah.
This is the government. Like, are they studying the national policy on Kisumu?
I would look at it. I'm assuming this could have been a while ago. There used to be like, I don't remember the name. It's like, not really wide, but there was a small, certain market where it would be under some local authority, and maybe they would have very specific policies. but to be honest, I can't confidently say.
It's very difficult to say. And then of course they put here the word Caribbean. So then they're talking about Kisumu. Then you're wondering, are there some Caribbeans in Kisumu? Kisumu has moved to the Caribbean. Yeah, so you know, those are the issues. So you can see, you don't immediately know what they could be talking about. And often this is not a good sign. It's not a good sign if you cannot tell from the title, because when I was doing my master's, I was told that you do everything and then when you finish it, that's when you get your title. So that your title is reflecting everything that you've done, right? Not the other way around, although of course you may start with an idea. So it turns out this was about, they were trying to look at the impact of malls, MALLS, malls like Galleria, like Waterfront. That's what they were trying to see, whether that has changed the diet of the people around them, and if whether the policy has caught up with it and what kind of policy they would want. And mind you, the study is going on up to date, they produce very good papers, but this very first thing was just, So when I was reviewing this proposal and I said, this is about malls, I just thought, what is that? Yeah, so we asked them, of course, to change their title. And I keep saying this when I teach people how to do a proposal, is that they will be so annoyed with you. Yeah, but if you really feel it was not communicating, then you are allowed to say this title is not communicating. As Eli said, it's not just all about taking check boxes and saying, okay, we've approved. We actually are trying to make the study better as an ethics committee. We're actually trying to make it better. What about the second one? Let me see somebody else. Glory, can you read this one?
Neurological assessment of patients on antiretroviral therapy in the U.S. military HIV research program, or President's Emergency Plan for AIDS Relief PEPFAR, supported programs in Africa, Kenya.
Africa, Kenya. So it is Africa, but Kenya. Okay. Purpose, population procedure. Anybody wants to tell me what they think this study is? What do you think they're trying to do here?
I think they want to do a viral load assessment on patients who are on antiretroviral therapy, but they have to be in this PEPFAR program in Kenya.
Supported by both programs, yes, military HIV research program and PEPFAR.
Yeah, they kind of came together. Those two. In the end, PEPFAR was always combined with the military. Okay, so that's what they want to do. So who do you think they are looking at? Their population?
Patients on ART.
Yeah, patients on ART. Excellent. And what do you think they are going to be doing?
Viral load assessment.
Yeah. So when you read this title, do you immediately start thinking, so what? Or what? When you read the title, so now that you know,
Yeah, the benefit is not coming out.
it's not. But when now you're reading the proposal, you might now start looking for the benefit. So are you trying to say, is it because they want to show that the program is working? Is it that they want to say that the program is not working? What is it they could be doing? But this is a better title, isn't it? Very, very quickly we could tell what to expect. What about this third one? Let me ask Disney. Can you read that one for us?
An open label multicenter randomized adaptive platform trial of the safety and efficacy of several therapies, including antiviral therapies versus control in mild or moderate disease.
Yes, this is where now many persons switch off. They just switch off. So can anybody unpack these words for us? Anne is smiling in her heart, I can see. She's not smiling outside, but she's feeling so happy because she wants to get herself into this study. So anybody want to unpack this one? I told you some titles can be an abstract. This one is very short. Open label. What does that mean?
Everybody knows what's happening. Not randomized, not blinded. Or not blinded, but randomized.
But it talks so quickly, so I'll say it's slow.
Sorry.
Everybody knows what's happening. So in a double-blind study, nobody knows who bought which drug, right? only the pharmacist knows, but even the person, the doctors and even the patients themselves do not know. But open label means everybody gets everything, and that is why you saw the example we saw about the example I gave you of plum peanut. So there were two things they could have done differently for plum peanut. Instead of doing it placebo control trial, they could have done it open label, they could have done it pre-post, they could have done it step-wedge. So that in the end, everybody gets that, the plum peanut. So this one, everybody is getting the therapy. Okay. Multi-center?
Wait a minute.
Yes.
It says, it's not just antiviral therapy, it's including antiviral therapy?
Yes.
So what is everyone getting?
Whatever it is they will be giving. So there were several therapies, the safety and efficacy. So during COVID, you can imagine, do you remember dexamethasone?
Yeah, everyone tried everything.
Yeah, we even went to Loliondo and got some of that. So they would take one drug, test it. If they felt it had no clinical efficacy, they would take another drug and test it. So there were several therapies they were testing, but it was open label. So if they were testing dexamethasone, they would give it. If they were testing hydroxychloroquine, is that one that we were, yeah. If they were testing that, yeah. Everybody would know you're getting hydroxychloroquine, even you, the doctor, everybody, and then they would follow you to see whether how you're responding to it, okay? So that's, but including antiretroviral ones, yeah. And I don't even know why they say including, I mean, COVID is a virus. So why would you say including antiretroviral? But I mean, Kizungu ilikuja na meli, randomized? Randomized?
Patients were not selected for each one.
Yeah.
They were randomly
Yeah.
assigned to a therapeutic arm.
Yeah. Anybody know what adaptive platform is?
So yeah, we can keep on adding.
You can keep on adding and dropping, adding and dropping. It was very confusing for us as an ethics committee the first time we heard about that one. We had never seen it before. So, what do you think the procedures were? Now let's go to population. So if the purpose, we can tell they are testing the drugs, okay? What do you think the population is? Yeah. People with mild and moderate cases of COVID-19, okay? And what do you think the procedures could have been? The procedures, how do you think this study would have been